Let's talk about some solutions for thumb pain. So just in general, I see people who come into the office in physical therapy with thumb pain frequently, with those who are holding a pen for long periods of time, or even people who have to do a lot of work with scissors. So this can be a tricky thing to work with, because a lot of times the recommendations is to stop doing the activity that's causing the irritation, which you might have to do for work, or they'll tell you that you might want to use a thumb brace. But the problem with that is then you usually can't do your work because it restricts your thumb movement too much. So I'm talking about pain that can actually occur in this area, either on the front side or the back side. We call this the CMC joint area, or the MCP joint area of your thumb. So we need to provide some kind of stability, but we don't want it to be too stable where you can't do your work. The solution that I've come up with does involve a couple things. One thing is this tape called Leukotape. Leukotape is something we use frequently in physical therapy. It's a little bit different than what you may have heard before called KT tape or kinesio tape, because this tape has no stretch. It doesn't stretch at all when I pull it. And we don't need all of the tape, we just need a little bit of it. So I made a little bit of a cut, and I'm going to use that cut to pull to create the length, or I guess the width of the tape that I need. Just for time, I already made them right here. So let's go over what the taping looks like. Once I get this unbuttoned here, there we go. So what I'm going to do is I'm going to take my long piece of tape and I'm going to put it right on the back side of my hand. And I'm going to make sure the adhesive is sticking down, so then I can actually use my other hand to wrap this around. So now I'm going to go underneath and then up into the web space. I'm going to pull back down and through. That's the first piece of this. The second piece of tape is going to go just where you finished. We'll push it down a little bit so there's some adhesive on it. And then we're going to go into the web space first. We're going to wrap down to the bottom of the thumb, and then we're going to pull through again. Make sure that everything is down. And then the way this looks, you have a little bit of support on the inside of the thumb. It's wrapping underneath that joint that we call the CMC joint, and then it's also pulling through your web space. So when I'm using my hand, I can still grip the pen, I can still write, or I can still use scissors, but you'll find that there's a little bit of restriction, there's a little bit of support around your thumb joint, and that's exactly what you need, because you need to be able to give the thumb joints a break while still doing the work that you love. So give it a try. It might take a few trial and error situations first where you might make some mistakes, but over time it gets easier and easier to do, and I think it'll be really nice.